So just a little bit about the meniscus. The menisci are two structures, medial and lateral menisci. They're critically important. They cover, this is the medial meniscus, here's the lateral meniscus. You see they're discoid in shape, but they are actually quite differently shaped. And the cartilage on the medial side is much more exposed than on the lateral side. The role is as shock absorbers, the protectors of the underlying chondral surfaces. And they distribute the forces across a larger area and therefore help to preserve the cartilage surfaces. The lateral meniscus covering even more and offloading the cartilage surfaces on the lateral side more than the medial side. And that's probably why we see medial arthritis more commonly than we do lateral arthritis. What happens when we remove it? Well, contact stresses go through the roof. They skyrocket, and as a result of that, the patient is more prone to get wear and tear change. These are pressure mapping studies, which show some pretty pictures that show that after a meniscectomy, there's much more pressure generated in specific points. When a meniscus is intact, that is dissipated through a much larger area. And this is why the meniscus is such an important structure. And if we can preserve it, really we would like to do that. A meniscal tear comes in many shapes and forms. The one that we've been talking about for the locked knee is typically a bucket handle tear. Now, it's often much, much bigger than is seen here, but various shapes of meniscal tears can be seen. And a meniscal tear in a young person nearly always comes with a history of trauma. But as we get older, the meniscus, the shock absorber, just gradually changes in structure. And it doesn't take a lot of trauma. It doesn't take any great story for a meniscal tear to occur. Meniscus is a really important structure, but once it starts to crack up and become displaced, instead of protecting the cartilage surface, it can start to gouge it out and damage it. And this is why a persistent knee pain, locking, swelling, or a sense of instability to the knee are the mechanical symptoms that we want to take from the history. And these are symptoms that we would like to be treating the patients early with so we can limit the damage and, if possible, repair the meniscus. So a meniscal repair is actually quite successful. Most menisci are not repairable. If it's a degenerative meniscus, then it's not repairable. But in a young person, the success rates are really quite high. The problem is that very commonly these patients are just presenting too late.